vaccines impair fertility, and therefore most professional bodies have issued statements recommending vaccination in women both trying to conceive, who are pregnant, or are breastfeeding. And as we can see in Malaysia, the guidelines do now recommend COVID vaccine for pregnant and lactating mothers, and in Singapore as well. So what do we do now when COVID is endemic and we think of the service adaptations about COVID? This is one of the sort of workflows recommended by ASHRAE with the uptake of vaccination. And so I think it makes sense that if you have been vaccinated or previously been infected with COVID, then you should be able to just carry on and go through your treatment as per normal. If, however, you're not vaccinated or you haven't previously had a COVID infection, then you should be tested and allowed to continue with treatment if the test is negative. And obviously, if you test positive, then treatment should be postponed until the patient has recovered from COVID. And of course, one of the other impacts on the fertility treatments are with regard to cross-border treatments. Not all countries allow all forms of fertility treatment. So with regard to egg freezing, which is not allowed in Singapore, previously, I think there were women who would travel to neighboring countries such as Malaysia for facilities such as this. And clearly with all the travel restrictions, this has not been possible. So you can see that, you know, the newspapers have reported how the hopes of single women hoping to seek fertility treatment overseas have been restricted by this. And so I think we all look forward to the day where we will be able to move about freely again. So I've come to the end of my talk, and to summarize, you know, at the beginning of the pandemic, infertility treatments were initially halted in most centers around the world. However, as of now, I think most have resumed with safe management measures. There is a considerable psychological impact on patients who are really keen to have babies, and to be told that you have to stop your treatment because this pandemic is devastating.